We have Dr. Anthony Fauci with us as Chief Medical Advisor to the President of the United States. Doctor, very good to have you.
Good to be with you, Neil. Thank you for having me.
What do you make of what Ireland's doing? I know I'm just dumping this on you. It just flashed here. An overreaction? How do you feel about it?
You know, it could be an overreaction, but I don't think we can make any comment about that, Neil. There's a lot of unknowns here, and literally in real time as the days go by, and sometimes as you've just shown with that recent flash you got, as the hours go by, you learn more and more. But I can say for us here right now, with regard to what we need to know about transmissibility, about severity of disease, about, relatively speaking, whether the vaccines and or the boosters, what kind of protection we get, those things are still actually being sorted out. We're getting a lot of good information from our South African colleagues who have the bulk of the cases now. But as you've mentioned on the top of this introduction to me, that we're starting to see cases right here in the United States, and we'll be learning in real time from our own cases. So I don't think that we should be able to say what's being done in one country is an overreaction or an underreaction. Really, I don't think we can make that kind of determination.
It's probably too early as well, Doctor, I assume, to peg or relate some of these cases, because at least it was thought, certainly in terms of the first guy we heard about in Minnesota who had taken a trip, to Africa, and so would have been exposed to it. But a lot of these other cases involve people who had never been. Should that worry us?
Well, what it tells us, Neil, is that there's community spread. And once you have community spread, then you're going to be seeing cases popping up all over the place because they're under the radar screen. Because we know from Delta that a substantial proportion of cases can be without symptoms and can spread to another person even if you don't have any symptoms. So the thing that caught my attention, Neil, was the person who was in New York City and then got infected there because there was no contact with anyone that he could identify was in, for example, Southern Africa, and he himself certainly was not. So that's the kind of thing that raises some alarms about the under-the-radar screen spreading throughout the country, which tells me, Neil, that we are going to start seeing in the coming days more and more states and more cases that are going to have it. There's no doubt about that.
So let's talk a little bit about how you know if you have it. In other words, when people get a COVID test, Doctor, will now this be among the things you look for?
This particular variant gives a certain signature on a PCR test, Neil, so that even if you don't specifically look for this variant, when you do a standard PCR, it has a certain signature that something is missing in the binding of this particular primer that we say when you do a molecular test. It's called a spike gene dropout, which means that if you're looking for one type and you don't see something there, you know this is highly suspicious of being Omicron. The good news about that is that the standard PCRs that we use will pick it up. And that's really how the California case got picked up, and the same thing with the New York cases.
You know, you had mentioned earlier in some interviews about you hope that maybe one of the good things that would come of this, I'm paraphrasing here, is that people who are not vaccinated would get vaccinated. But I hear as much from people who have not been vaccinated, who are now sure as hell they will not get vaccinated, because if you can get this, and you hear about, breakthrough cases, my own included, Doctor, and I was fully vaccinated, and they hear about this, people who have the full vaccination, even get the booster shots and still getting hit with not necessarily this variant, they're saying, no, I'm not going to bother. What do you tell them?
Yeah, but the thing about that, Neil, is that you don't want to get into a situation where you don't fully realize that very, very often, and the data clearly show that, if you are vaccinated and get a breakthrough infection, which there are a lot of breakthrough infections, you yourself mentioned your own personal situation. However, we know now that when people are vaccinated, even when they do get a breakthrough infection, and compare the likelihood of their going on to a serious hospitalization and even death is much, much greater in an unvaccinated person than in a vaccinated person. So although I can understand a person saying, well, if there are breakthrough infections, why should I get vaccinated? They need to understand that even if they do get infected, if they were not vaccinated, they might have had a much, much more serious course. And if you look at the whole cohort of patients who get infected, there's no doubt, recent data, Neil, just came out that if you are unvaccinated and get infected versus vaccinated and get infected, the likelihood of your getting hospitalized is much, much higher if you are in the unvaccinated group.
Yeah, and I was vaccinated. It was relatively mild. I tried to milk it for all the attention I could, doctor, but the fact of the matter is that it could have been a lot worse. Could I get your take on whether we've gotten to this natural immunity point in this country? I was talking to Dr. Marty McCary earlier in the last hour, doctor, about the fact that there are probably enough Americans now who have a natural resistance to this. But what I also hear from many Americans is they assume they do without confirmation of that. Where are you on this and whether we've hit that inflection point?
Well, there are some knowns and some unknowns, Neil. For sure, you can't deny that many people, in fact, maybe most people, who wind up getting infected and recover do have a considerable degree of immunity that would protect them against reinfection. The thing we don't know, because we have not studied it that carefully as well as we've studied the immune response to vaccination and to booster, which we have a really good handle on that, is that as a person gets infected and gets mild symptoms, versus a person who gets infected and gets moderate to severe symptoms, or a person who gets infected and maybe is so sick they have to go to the hospital, is the level of protection following their recovery very different? See, we don't know that, so you can't assume that when you get infected, you all have a uniform level of high degree of protection. That's not to take away from the fact that you can't deny that people who do get infected and recover clearly have a degree of protection. The one thing you do know, that if you get infected and recover and then get vaccinated, the level of your protection after that is as high as you can imagine. It's really, really way up there. And that's the reason why the CDC still recommends that if you've been infected and recovered, that you do get vaccinated, not denying that you do have a degree of protection when you do get infected.
Well, where are you on the vaccination? I know you're personally recommending vaccinations for people. It seemed that the president, in his remarks yesterday, had a rather tame approach to this, not calling for mandates per se, even though he's had a fight with the courts on how far he can go, but urging Americans to get vaccinated. So where does Dr. Anthony Fauci stand on forcing the issue?
You know, I never liked the idea of forcing the issue, but the only thing, Neil, that's important is that we know the importance of vaccination. We know the data are overwhelming in protecting people, particularly against severe disease, hospitalization, and certainly deaths. I would hope that even now, as we enter into this new era of Omicron, that people would appreciate why it's so important. You know, you hear me talk a lot about boosters, Neil, and the reason I do is that if you look at the vaccination, we were vaccinated against the original, what we call ancestral or Wuhan strain. Yet when you get antibodies from that vaccination and when you get boosted, the level of protection spills over to Delta, to Alpha, to Beta, and very likely will spill over also to Omicron. So that's the reason why I'm saying.
Do we know that for sure, though, Doctor? That I know the FDA is aiming for a speedy review of Omicron vaccines and drugs, but do we know that the treatments that are already out there, the vaccines that are already out there, the booster shots that are already out there, can address this?
No, we are not. I'm always honest with you, Neil. We have not proven it in the field. But if you look at the level of antibodies that are induced by vaccine and by boost, literally within the next week or so, maybe a week to 10 days, we'll be able to assay those antibodies on the Omicron strain and the Omicron variant. So we'll be able to know the level of the degree of neutralization. But if you make an extrapolation and look at vaccine-induced antibodies and even convalescent antibodies from being infected, when they go up, they do spill over to other variants. So you can make an assumption that we will hopefully soon prove that as high you get with your response to a primary vaccination and a boost will have a beneficial effect in protecting you at least from severe disease from Omicron. But we'll be able to prove that pretty quickly.
You know, here we are, though, post this pandemic or through this pandemic, where only about 4 out of 10 Americans have returned to work or returned to their physical offices. And just today, Dr., we learned that Google is pushing back their return from January to just indefinitely. They're leaving it open-ended. What do you think of that?
Well, I would like to see people get back to the workplace. You know, we were successful in getting the kids back to school, which I think was a big step forward. No one wanted to see the children in virtual learning for a long period of time. We'd like to get people back to the workplace. And again, Neil, I just get back to what I'm saying. The easiest way to do that from the data we know is to get as many people vaccinated as we possibly can and as many people who are fully vaccinated boosted. That will cut down on transmission. That will cut down more so on hospitalization and severe disease. So if you want to keep people well enough so that they don't have to be absent from the workplace, that's the reason why we're pushing vaccination and boosters.
That's also why we're testing people coming into this country, you know, to see that they're COVID safe and all of that. But I was thinking, I know you've been asked about this in the past, Doctor, about what's happening at the border right now. We have about 18% of the migrant families here, 20% of unaccompanied minors testing positive for the COVID. If you use the figure of 20,000, and that's a loose figure, Doctor, who have been apprehended, that could be up to 4,000 individuals who have COVID. What do we do about that?
You know, Neil, I don't have an easy answer for that. I mean, obviously, Title 42 is still operable at the border, trying to keep people who should not come into the country. There is testing that is done. I'm certain it's not as extensive as we would like to see, but I have to admit, Neil, I don't have an easy answer. That's a very difficult problem.
I'm just wondering, though, would that, if those numbers are indeed the case, it would dwarf whatever good we're trying to do at airports, though, right? I mean, just looking at the sheer numbers.
Yeah, but you know what I think is going to happen that's going to possibly make this even a moot point? I think given what we know about the transmissibility and likely a transmissibility advantage of Omicron, we've seen that in Africa with the spikes that are going up. Once it gets in there, it will likely, under the radar scheme, be spreading no matter what you do to keep people out or not. That's the way viruses work. We saw that happen with Delta. I do hope that Omicron doesn't have that kind of advantage, particularly if it turns out to be serious. The good news you mentioned is that even though you can't make a full extrapolation based on a relatively small number of cases, we don't seem to see a signal of real severe disease, though we need to get many, many, many more people to follow to determine the severity of the disease.
You know, Doctor, many times we've talked in the past, you've talked about you follow the science. I think you acknowledge that the science can change. At first, you dissuaded the public, from buying masks back in the spring of 2020. You described the risk of the COVID to the U.S. Later that year as minuscule. Things change. The science changed. To your point. But in answering some of the criticism that you've received, you said, "I represent science." So, are you saying there that your critics do not, and that they don't have a clue? Could you clarify that?
No, I wasn't being pejorative to anyone, and I'm certainly not. I mean, I can take criticism, and I'm not being pejorative against critics. What I'm saying, if you look at what I'm talking about, Neil, the only thing I'm saying is that it's important for people to get vaccinated, because as a scientist and a physician and a public health person, I mean, it's very, very clear the extraordinary benefit of vaccines to protect you against infection, to protect you against severe disease, hospitalization, and death. We also know that masks work. There are many, many studies now that talk about and actually prove the important preventive capability of masking. And for that, I'm getting criticized by so many different sectors that are putting ad hominems against me. And what I say that is that all I'm doing is talking science. So when you're coming at me with bullets and slings, I mean, what is it that you're criticizing? You're criticizing what I'm saying, and what I'm saying is public health-based and science-based. So that's what I meant when I said I represent scientific principles. And if people are starting to criticize that, you have to come to the conclusion that they're criticizing the scientific principles. That's what I meant. I wasn't being pejorative against anyone.
So the president still stands by you and what you're doing, or he wouldn't have made the reference that you're the president yesterday. I know he was joking, but he still stands by, and there's no change in that.
No, not at all. Not at all.
Okay. I am curious as well about you personally dealing with this. I mean, you were a rock star at the beginning when this was going on. You're sort of this button-down health official telling people you're on top of it, all of that. And something changed with the controversy of the origins of all of this, what you knew when you knew it. Without getting into those details, have you gotten to the point where, after dealing with this for the better part of 2+ years, just saying, the hell with it, I'm done with this, I'm going to step down?
No, absolutely not, Neil. And you know, you talk about, you know, people put data out like he's this now popularity or not. I'm not running a popularity contest for myself. I'm a physician, I'm a scientist, and I'm a public health person. The only thing I care about, Neil, is helping to preserve and protect the health of the American public. And indirectly in that regard, since we're a leader in the world, protecting the health and the safety of the entire world, because that's what we do. That's what I've done for the 50 years I've been a physician, and for the almost 40 years that I've been the director of the Institute. So whether people on one side or the other like me or don't like me, that's not relevant to me. What I do is I focus on my job, and that is to get us out of this pandemic, which has already killed 780,000 Americans. And I think all that other stuff, Neil, is noise. When they say they like him, they don't like him, some people are in favor of him or not, that is really meaningless stuff. My job is the health of the American public, and that's the only thing I focus on.
So when your word was gospel in the very beginning, Doctor, and then people say, well, maybe he knew more about the origins of this or let on, or maybe the 180 on masks proves that, you know, he's not, you know, that prescient on all these things. At any level, does that bug you, that people, a good many people who trusted you don't trust you as much now?
No, I can understand how that's the case, but I think you'd have to admit, Neil, that there really has been a considerable degree of politicization about all of this. And I have stayed out of politics for my entire career, but there's such divisiveness in the country that since I'm a visible person and I'm out there a lot trying to get the public health messages, I understand how I could be the target of criticism. Well, like I said, it's not pleasant. I don't like it. But that's not going to deter me from what my primary job is, which I said is really looking after the health of the American public.
So what does the American public, to wrap things up, Doctor, have to look forward to or not here? Is the reality now, whatever happens with this variant, that it's going to be treated like the flu? We're going to always have it around. There are going to be annual shots, that sort of thing. How do you see this sorting out?
You know, Neil, I don't have a definitive answer because we cannot know. When you think about infectious diseases, you think about pandemic level, which we're at. Then you have a deceleration when the cases come down. Then you have variable degrees of control. You can have elimination or you could have eradication. And as I've said so often, is that I don't think there's a chance you're going to eradicate this, because we've only eradicated one virus for humans in history, and that's smallpox. Elimination is tough. We've eliminated polio from this country. We've eliminated measles from this country, and we've done it by very effective vaccination campaigns. I'm not so sure we're going to be able to do that, at least not in the near future. That's aspirational. So what I'm thinking about is control, namely a level of control that is well better than where we are right now. Because yesterday we had 95,000 new cases. Hospitalizations are still creeping up. The deaths are staying about level. But we've got to get that level much lower, Neil, so that even though we don't eliminate it from the country, it is at such a low level that it doesn't interfere with our lives, our lifestyle, our economy, what we do with ourselves, that it's there in the background. And when we get enough people protected, either from getting infected already, getting vaccinated, getting boosted, that's where I think we're going to be. Whether or not we're going to need a vaccine boost of some sort at intervals, I don't know. It's likely that will be the case. We do know that with the boosters we're giving now, we're getting not only a higher level of immunity, we're getting a more breadth of immunity, which I believe may give us more duration. So better control is what I think we need to look for, and then we can get back to some form of normality to our lives.
Yeah, let's hope so, right? Dr. Anthony Fauci, a real pleasure having you. Dr. Fauci is the Chief Medical Advisor to the President of the United States. We'll have more after this.